Welcome, everybody. This is Doug McCall from the International School Health Network. I'm here to introduce Dan Laitsch, who will be talking about health and life skills education as part of a broad holistic education, and one member of the panel that's occurring in Miami at the CIES Conference. First, I'd like to extend my personal apologies for not being there in person. Some personal circumstances prevented me from going. But it's my pleasure to introduce Dan Laitsch, who is an associate professor at the Faculty of Education at Simon Fraser University. And Dan chairs the International Research Network associated with this project, sponsored by the World Education Research Association, and is co-chair of the working group that's been established by the FRESH Partnership. So it's my task and pleasure to introduce Dan to you and to ask him to make his remarks today, and looking forward to hearing more about the session in the days that come. Dan?
Hi, good morning, and thank you for the opportunity to join you guys, even if it's remotely, and my apologies along with Doug for not being there in person. But right on to the presentation. I look forward today to talking with you about some of the work that we're doing across four different initiatives that Doug referenced. The first one is the FRESH Working Group. We're also involved with an international research network within the World Education Research Association, and a consortium of education and other faculties, which is led by the Global Network of Deans of Education. And then finally, talk about a fourth initiative, the Preventing Violent Extremism Project, and advisory committee work there. The FRESH Working Group is a group of primarily individuals at UN agencies, universities, and NGOs who are working in and interested in health promotion and health and personal and social development. They come together in a series of web meetings that are led by individual experts in particular areas. These web meetings have been recorded and are archived, and then will be synthesized and rolled into a final report, which will be coming out in the fall of 2020. At the same time, we're part of an international research network within the World Education Research Association that's focused on the research agenda around these issues. The World Education Research Association is a global association of national education research associations. So this is a high-profile, research-intensive organization focused through the research network on health promotion and social development. There is also a consortium of education and other faculties led by the Global Network of Deans of Education. This group came together because one of the important things around policy development and policy conversations that we noticed at the global network or global level is that frequently educators are not part of that discussion. So this was an intentional effort to make sure that deans and faculties of education and health sciences and other related faculties were a part of these broader international conversations. And then finally, we take it down, and you'll hear more about this later when we think about the Preventing Violent Extremism project. One of the challenges we face in HPSD is that typically we tend to default to a project-based approach, and through the Preventing Violent Extremism project, this is our effort to think about what it would look like to engage in that work, not as a programmatic effort, but instead what would it be like to approach that program through a health promotion perspective, and trying to reverse some of the trends we've observed over the last decades. So before we get really started in the work, one of the first things we wanted to do was a synthesis or an issue status taking. Where are we now? What is the reality that we're dealing with? And if you look at and talk to educators about their work in health promotion and health personal and social development, really what you find is that the approach is not particularly systematic and is very much defaulted into a program-based approach where we're looking at specific issues or topics and addressing challenges from that individual crisis-based, deficit-based kind of response rather than a more coordinated or comprehensive response. We see previous curricular approaches which were very broad in scope and sequence, that were focused on student learning generally, being replaced by these topic-specific instructional programs or materials, and frequently they're provided in online and electronic formats, and fit into the curriculum where space allows rather than being a core part of the curricula. We see that in initial teacher education, there's very little focus on specialist training in health and personal and social development, that this is typically done as off the side of the desk as one particular interest within the broader work with initial teacher education programs, and that there's not a long-term workforce development perspective included. Moving on from teacher preparation, we get into the role that nurses, social workers, and other professionals working in schools might play. And again, we find gaps in their education training where they're even present, that many systems struggle to make sure that while we acknowledge the value of having nurses and social workers active in the schools, we're lucky if that's able to occur, and we're even more lucky if there's specific education and training that's been used to support their inclusion. So the end result is we really see that in the health, personal, and social development realm is kind of the poor cousin in the education system. It's an afterthought or a low status career track for teachers. There's not a lot of centralized national associations of people interested in doing these work, and so it really ends up being left off the side of the desk. So part of our work is to see how we can re-energize this work and bring it more into the core of the work that schools do. So the Fresh Working Group is looking at the context in which much of this work is done and how to raise the profile of this work and return it to a core function. The Fresh Working Group is looking at HPSD education across three contexts, what it looks like in high resource or low resource or conflict and disaster affected countries. We're looking at two types of delivery, both the formal curricula and classroom instruction, and the extended educational opportunities. So we're really interested in what's happening in classes and in schools from a formal perspective, but we're also interested in what's happening between classes and before and after school and on the playgrounds. So what is both the formal approach to health and personal and social development, but also what happens in the gaps. We're interested in the particular outputs that we might be able to achieve, and this relates to the knowledge and the skills and the dispositions that might result from work in this area, and what kind of sustainable behaviors can be supported through our work on HPSD. And the working group is looking at 4 different components and program structures, focusing on curricula, healthy activities, learning activities, and then interdisciplinary engagement. So how can we make sure that we have a core curriculum that's focused on HPSD rather than being seen as a component in PE or career education, or dealing with it in a more haphazard way. We're interested in the activities and routines that can be established through this work, and then the learning activities and the knowledge that is part of these outcomes, and then finally, again, making sure that we have interdisciplinary, cross-curricular, competency-based curricula. The next slide illustrates the challenge that we face. So you see the students in the middle of that cacophony, and all of the different pulls and pushes on them, on their learning, on their activities, on what we are hoping to help them develop as a society. And if you look around the more colorful circle, you'll see the various different influences, and we think about the role of poverty and hunger and health, education, gender. I'm not going to read the entire circle to you, but when we think about all of the things and influences involved, and then the role that we want education to play as the core advocate for health promotion and health and personal and sustainable development, you get a sense of the complexity of the work that lies ahead of us. And so when we think about taking that context and looking at the underlying theories that think about how students and educators and others work within that context, and what we are hoping to operationalize in realizing advances in health and personal and social development, we really want to look at the theories that make that link. And so you see a lot of different and at times competing efforts to engage in this work around literacy and health, security, and safety, thinking about functional knowledge, communication skills, digital and media literacy, critical thinking. All of these are buzzwords that are active in trying to reach out and engage students in this kind of positive change, focusing on life skills, coping skills, conflict resolution, social emotional learning, social inclusion, human rights, global citizenship, peace education. All of these are different areas in which people take some component of health, personal, and social development and advance it through these particular lenses. And so we want to see if we can bring some sort of coherence and unity to these kinds of individual theoretical and behavioral approaches. So what we're trying to do is engage leaders in these models to work more collaboratively and across communities, to think about how they define the key components or aspects of their respective paradigm, and how to describe the model and how it can fit into a more coherent and core-focused health, personal, and social development curricula that is both in but also across the subjects that we find in schools, and then in and across the curricular and co-curricular activities and school routines that students experience on a daily basis. Within this, looking at what we think would be the minimum requirement for students to be engaged in this kind of work. We recognize that it is a very crowded curriculum, and there's a lot of competition between and across individual curricular areas for space in the school day. So what is it that we think at a minimum needs to be done to advance the welfare of the community broadly? And then within that, to describe the knowledge, beliefs, awareness that teachers and other school-based or school-linked workers need to have in advancing that work. So this is a radically different starting point that we're thinking about, how we bring this into the real world and make it, operationalize it on the ground. When we think about most curricular program development starting with or being funded by what should be taught on a selected topic, what are the optimal outputs? Instead, we're trying to get the working group to define the capacity of the school and education system. So when we think about high resource countries, they might be able to designate a large number of hours of health, personal, and sustainable development instruction time over the course of the year. What would that look like? Would we be talking about 25 or 50 hours? Are we talking about how many hours, 10 hours of co-curricular routine-based learning or 10 hours of extracurricular? Do we need to get that specific, and what a number of hours at a minimum do we think is necessary for effective outcomes? In low resource countries, you may adopt that downward somewhat as the needs of the individual contexts change. and the capacity of the individual context is adjusted, and same in conflict and disaster affected nations. So our working estimate from looking at what we've seen is that 25 to 50 hours of classroom instruction is necessary, and that the topics we're interested in really need to have a focus of at least 4 to 5 hours in a particular school year. So our quick scan of the documents that are available online from about 20 countries or provinces found that half have defined minimum hours of classroom instruction, and there's a wide range of policy and guidance documents that are available, and we're engaged in content analysis that can be done on some of the HPSD outputs and how it's delivered in different curriculum structures. So what's our next step? We take again a look at what the status quo currently is, we see that we're beginning to engage in a fact-finding survey of all country, state, ministries of education to ask them about their HPSD instruction, their co-curricular routines, their formal and non-formal learning that's occurring in their schools. This is a survey that we're engaged in within the FRESH framework around policy, services, physical environment, and social support. The survey will be used to collect curriculum, policy, and guidance documents that are publicly available across nations, and eventually house them on the UNESCO and in other policy databases for broader access. And the Global Networks of Deans of Education is also seeking support for a study of the capacity of education faculties to help us understand and describe the status of teacher education and development programs that are related to HPSD where they exist. We're also working to think about long-term workforce development. So not only initial preparation, but what that looks like over the lifetime or the lifespan of an educator as far as long-term workforce development goes. So defining the required competencies for teachers, engaging in a systematic review of the training that's needed and also the training that's provided, making sure that we can articulate the teacher training needs for different areas. So when we think about what needs to be included for global citizenship, health literacy, social and emotional learning, sustainable development, and social inclusion. So the working group will work with existing and developed descriptions regarding the stages and structures of the lifetime career workforce development approach to teacher education and development, again in the 3 different contexts. That being high resource, low resource, and high resource, low resource. Sorry, Doug.
Yeah, conflict affected. Yeah, I'll jump in, Vista, a little bit. It's early in the morning here in the west coast of North America, so Dan's permitted to take a sip of coffee.
Yeah, sorry about that. Got lost in the slides there. But yes, looking at those 3 different contexts. So when you think about what we're looking at, an example draft of topics that might be involved for low resource countries. Access to schooling, and in particular, especially for girls, think about clean water, hand washing, personal hygiene, household and community hygiene, diarrhea, cholera, soil transmitted helminths, pneumonia, malaria, trachoma. There's a lot of different topics that need to be involved. Physical health, eye, oral, dental health, hearing, physical activity, immunization, accident, injury prevention, tobacco, alcohol, drug use, nutrition, diet, All of these things coming together when we think about what we need to do to include in developing a core HPSD curriculum for this target set of countries. When we think about it, the high resource countries, we think more about things like youth development, physical health, diseases, genetic attributes, general health, family conditions, health behavior, antisocial behaviors, mental health, personal development. The important thing to realize when we talk about these different contexts is while there's a lot of overlapping and related curricula, we also need to make sure that the curricula we're bringing into the schools is tailored to the specific context of the country's individual needs. So why do we need to help countries make better choices about their core curriculum and programs? There's two important reasons for action that's being taken by the working group. We cannot afford to continue this kind of haphazard problem-based or project-based or issue-based or deficit model approach to health. We need to recognize that this is an essential area of learning, and that the topic-focused packages present a very disjointed and unorganized and often competing approach to health promotion. The UN goals 4.7 offers us a policy opportunity to help countries and states to develop a coherent approach. But at the same time, UN decision makers are struggling to include health and life skills when developing target, for example, 4.7.1 and 2, looking at student outputs. The lack of a core set of outputs means that officials and others really are scared off by the many single topics, and it becomes quite difficult to organize. The lack of global tests measuring the essential student outputs needs an applied research program to really take a look at this. The absence of basic facts documents are a confounding problem. We really don't have a good sense of where we are globally, and then where individual countries are specifically. So is there a generic set of student outputs? Is it topic-based? What subject structure is being used? How much time is required? So the result that we're hoping to get to would be a new approach to health promotion, health, personal, and sustainable development, curriculum, and contextually sensitive, realistic, policy relevant, and practical recommendations. So looking at how we can create a more applied real-world method and develop a core curricula or program focus for HPSD learning, a global status report on the state of HPSD education and learning with links to what's currently available, basic indicators that can be used to monitor target 4.7 of the UN goals, an innovative incremental approach to addressing the huge scope that we're facing, construct a framework for developing the teacher workforce, including input into the Education Workforce Initiative from the UN Education Commission, and then look at a global research network to make sure that we are defining, testing, monitoring, and engaging in better understanding student learning around HPSD. So where can you go for more information? The Fresh Partners are available on the web. There's a link at the end of the PowerPoint. You are welcome to email me, dlaitsch@sfu.ca, and Doug McCall at the International School Health Network, Doug McCall at internationalschoolhealth.org. We look forward to engaging with you and to hearing from you. Thank you for your time, and I'll turn it back to Doug for any closing comments.
Thank you, Dan. And for those of you in the room in Miami, Dan is available online during the session. And as per the conference format, we'll be able to respond to questions at the end of the whole set of presentations. Thank you, Dan. Thank you, Dan, for an excellent overview. And I know how challenging it is sometimes to be talking to a computer and without knowing there's an audience at the other side. So thank you for taking the time early on this in this morning, and looking forward to having a real live discussion later on today. I'm going to stop the recording, and we'll turn it back to the organizers in Miami.